Hi, this is Savina. Welcome to Becoming a Mum, Pregnancy and Beyond. In today's episode, I'll be going through a worrying but normal pregnancy side effect called spotting. Spotting is when you have some vaginal blood discharge, usually lighter than your period, which can occur from changes to your cervix. This is a very common symptom of pregnancy. It is important to note, however, if you have any type of bleeding, contact your midwife and seek medical advice promptly, especially if the bleeding is heavy. Sometimes heavy discharge can be a sign of a miscarriage, so remember to contact a health professional immediately if you have any concerns. Speaking from experience, spotting is very concerning when it happens because you don't normally get your period during pregnancy, so any sign of blood feels very alarming. I remember spending the evening at my in-laws' house where I played with and picked up my 2-year-old niece as I normally would. But for the first time, I asked my husband to leave almost immediately after dinner. I didn't want to alarm the family, so I waited until my husband and I got into the car to tell him I was bleeding and was feeling very concerned for the well-being of our baby. I tried to call my midwife, but as it was quite late, I didn't get an answer. I didn't have any other midwives or hospital contact details with me, so we headed straight to A&E. To my surprise, when we reached the hospital, I was not prioritised. Instead, I was told I'd have to wait my turn as patients were being seen in chronological order based on their arrival and symptoms. So, be prepared for this. Lucky for me, the queue for an initial consultation wasn't too long, so I was seen to within an hour or so. I spoke to the consultant, explained my concern, and as the bleeding was not classified as extremely heavy, I was told I'd have to wait a few more hours before I'd be seen to for further tests. By this time, it was well past midnight and I was feeling quite exhausted, so my husband and I decided to go home, call 111 en route to seek medical advice, and received a call back from a midwife to go through the details of my spotting. Based on what I described I was going through, the midwife provided us with reassurance that my symptoms were nothing to be alarmed about, and if the spotting continued, I should speak to my midwife in the morning and see my GP so he could check our baby's heart was beating as expected. We took her advice and went to see my GP the next morning and were told everything was fine with baby and the amount of spotting I had described was a normal sign of a healthy pregnancy. So my advice to you would be to 1. Avoid any form of heavy lifting. 2. Make sure you save all the relevant contact details of your midwife, her team of midwives, and any out-of-hours emergency contact numbers in your phone. This will save you a lot of stress. 3. Contact your midwife, GP, or go to A&E if you experience any form of spotting or bleeding. And 4. Try your best to stay calm and not worry or panic. If you found today's episode useful, please share it, follow, and subscribe to get episodes every Monday. Thanks. See you next time.